So I am Dr. Nandni Gokulchandran. So I do head the Neurogen Brain and Spine Institute of Medical Services, but also we have another center which is for non-neurological conditions. So a lot of my work is on neurological condition, but today I would be speaking more about anti-aging, the science behind it, and a little bit about our experience, but more about the science behind the anti-aging, a little bit about stem cells, but more about the non-stem cell part of anti-aging as well. So the topic that was given for this particular hour was regenerate your wellness with anti-aging, and I will be talking a lot about the theoretical aspect, but practical for us, and my colleague Dr. Pallavi would be talking hands-on about the ozone therapy. So immune boosting and anti-aging. So anti-aging for gynecology and obstetrics, or rather gynecology, is a concept which is very, very local. But before that, even for you and me, stress is a big factor, and that leads all of us to age earlier than we actually are, right? I think a lot of stress you can see on my face because of lack of sleep. So similarly for all of us, none of us is, exempt from this early aging process today due to various factors. So this is KLS Center, KLS Wellness Institute for Wellness and Anti-Aging, which you can see here, along with Neurogen Brain and Spine Institute, which is the parent organization of mine. So we have all worked very hard, right? Isn't it? Right from, even before we entered the medical school, we worked very hard. We entered the medical school and we worked day and night, and at times we didn't know where the day ended and where the night started, and all that to build ourselves to become professionals. So the life is full of stress, and I wonder where the stress is ending. It is not ending. If you see the current generation who have come later, you will see, oh my God, we have taken so much stress, and what are these girls or boys doing? They don't want to take stress anymore. They want a work-life balance. But we are not able to get there. There is no work-life balance, and that leads to a lot of stress right from the family, our daily living, commuting, transporting, work, finances, illness, all at the cost of our body and our mind. So headaches and migraines, ask me about it. I mean, I'm a living example here. So headaches and migraines, body aches and pains, diabetes, high blood pressure, this is now part of our life. And of course, something which we don't really pay so much attention to is stress leading to infertility and menstrual disturbances. So many PCODs we see these days, isn't it? More than what we used to see when we were younger, isn't it? So as gynecology practitioners, you would see so much of PCODs. So all of these together, as I said, at the cost of your body, we are aging faster, we are conceiving later, but aging faster. So, and the COVID-19 pandemic, when I put it in the mix, it has created more chaos. We have seen that the COVID-19 pandemic has affected us in many different ways, and many ways we even don't know about, right? So we worked a lot in COVID-19, and we worked with COVID. In COVID, we converted, though we were not a general hospital, we had a lot of experience in COVID. I'm sorry again, I think, yeah, it gets stuck. And we have, I don't even know how to count these numbers, so many cases with so many deaths, and those who are living are still reaping the side effects of the COVID. So from there and even before that, the concept, a lot of you do know about this very prominent name in the field of regenerative medicine, Dr. Alok Sharma. So he thought not only about regeneration, but prevention. So that the tagline or our USP is to prevent the preventable and delay the inevitable. There are some things which are inevitable. Arthritis is inevitable. Menopause is inevitable. But how can we try and delay it and prevent some of the things? So how can we delay? So we worked, how do we know and how have we come to this conclusion? Because yes, we have worked a lot on stem cells or cellular therapy for neurological condition, but we have also worked on other aspects like ozone and hyperbaric, a lot in COVID. In fact, we looked at we did a lot of work, and we did work on ozone to treat COVID. So we did a clinical trial of using ozone in moderate COVID patients and prevented them to become severe and got them out of oxygen requirement faster. We also did a preventive study even before the vaccine came, how to immunize, how to prevent a healthcare worker from becoming COVID positive. And all the workers in our center, some of them took the ozone saline or ozonized saline as the immunization, and some did not. And we found that those who became positive was much less in those who had received the ozone. So we have worked on various different aspects. As Neurogen Brain and Spine Institute on neurological condition, Dr. Rajput very well put together the need of stem cell therapy in muscular dystrophy, in cerebral palsy, and we do a lot of work on autism as well as adults in stroke, and we have actually worked in COVID as well as anti-aging. Now, anti-aging, the oldest person in the world so far registered is 122 years. Can we now imagine to live like a healthy life till the age of 122 years? She lived through all the world wars. She lived through Spanish flu. She took care of herself and had a fruitful life. But that required a whole lot of activities which we currently are unable to do. So when we are looking at aging, we are looking at a whole lot of disorders, right from the hair to the toe. We're looking at eye and vision problems, swallowing difficulties, skin wrinkling, thyroid disorders, diabetes, obesity, bone density. As females, we know bone density, all of us, I think our bone densities are quite low. Heart, cardiac issues, lung issues, kidney issues, leaky gut, muscle mass, and all of that does affect our overall health as well as our gynecological health as well. Thinning of the endometrium, which I think you're seeing a lot of it in females, a lot of brittle bones, breast cancer, lower estrogen levels, hot flushes, menopausal symptoms earlier than you would otherwise see, osteoporosis, uterine cancer, a lot of these factors. At the cellular level, what is happening? This is at the level, at the phenotype or external level. What is happening at the cellular level? This is what is happening. When you look at the DNA, we have telomere. We do know about this, right? We know that it's a, I'm sorry. Okay, I don't know, this is not working. So you can see the X there, and that is the DNA helix, and at the end of it is the telomere, and as the cell ages, the telomere shortens, and at one point the cell dies. So that is the apoptosis or self-death. So shorter the telomere, faster that it is dying. Okay. So there are two studies which have been done looking at telomere length and aging. One looked at lifestyle changes and other looked at the role of hyperbaric oxygen therapy. So this is a comparison that we are going to make between these two ways that we can keep our cellular age or our body younger. So when we say body younger, it doesn't just mean skin or cosmetic, it also means our blood sugar levels, our cholesterol, our body within us aging. So what are the two ways? Lifestyle changes. What do you need to do lifestyle changes? 35 men, this particular study looked at 35 men for 5 years, okay? Intervention group of 10 men, control group of 25. Intervention group had proper diet, did proper exercise, did stress management, did yoga, pranayam or meditation, social support, good family life, work and personal life balance. And in 25 control group, no lifestyle changes like we are now, right? We sleep whenever we want, we eat whenever we want, we sometimes eat, we don't eat, sometimes we do intermittent fasting, sometimes we eat a lot of sugar, we hardly get to do exercise, we don't drink enough water. My mouth is drying. No, I'm also an example. I keep on saying I'm an example of similar to what is currently happening. So what happened in the control group versus the lifestyle intervention? In the lifestyle intervention, what we can see is that the mean age of the telomere. What is a telomere test? It is a blood test, and in the blood there is a way to look at the telomere length. The telomere length increased in the intervention group, while in the control group the telomere length reduced, okay, over 5 years. So aging can be reversed, of course, by vegetarian diet, by exercise, stress management, breathe properly, sleep well, drink enough water, regular exercise, social support. But how many of us are able to do all of these things regularly for 5 years? If I do it regularly for 5 months, I think I've achieved a lot, right? But regularly for 5 years. So on the other hand, this particular group, Aakriti et al. From Israel, did a study which published in 2020. And what did it do? It looked at 35 healthy, independent living adults of over 64 years who received hyperbaric oxygen therapy for 60 days, every day. And they found by just the 60 sessions, the telomere length increased by over 20%. This is a study which is published. So 20% increase in the telomere length in 60 days using hyperbaric oxygen therapy every day. So almost the cellular age reduced by 10 years. So this is what we are looking at. So the idea is to try and use or try and understand modern advanced technique to be able to supplement our efforts. Doing hyperbaric oxygen therapy doesn't mean that you do not sleep or you do not eat properly or you do not do exercise. You have to do all that. But plus when you combine this with hyperbaric oxygen, you see that the senescence or senolytic effects are reduced. So there is an increased telomere length and there is a clearance of the aging cells and fresh cells or stimulation of the stem cells in our body. That's what hyperbaric oxygen is doing. So the comparison is 5 years of vegetarian diet, exercise, stress management, social support versus 60 daily sessions of hyperbaric oxygen. That's what you are getting. Okay. So let's look at immune boosting. Immune boosting, of course, diet, vitamins, minerals, steam inhalation, 8-hour sleep, all of this. We tried all of this in COVID, right? We were successful in some, we weren't successful in some. But despite all of this, we still have low immunity. We do fall sick. We do get, and especially in Delhi and even in India, I think India is one of the highest polluted countries in the world now. We fall sick every season. So we are susceptible to a lot of diseases. So more intensive immune boosting is required. And it is more required so in our population because we cannot afford to fall sick. Can we? How many sick leaves have we been able to take in a year? So it's important for us to have immune boosting, and that's where we looked at putting a combined program. It's never one single, it's always a teamwork. We believe in teamwork, and so we put together a program at our KLS Wellness in News. We combined hyperbaric oxygen therapy, ozone therapy. I'll talk a little bit about it. My colleague will talk a little more in detail about it. Micronutrient therapy, because we don't eat well properly. Even if I say, oh, we should eat better and we should have all the nutrients in our food, it doesn't happen. So we are vitamin D deficient, vegetarians are vitamin B12 deficient, and we don't know how many more deficiencies we have. So micronutrient therapy occasionally is important. Gut cleansing. There is so much talk about gut-brain axis now, not just gut-brain, gut access to all diseases. Naturopathy and Ayurveda, our age-old sciences talk about gut cleansing. So yes, we have to find a way to cleanse gut in an easier way, and that's through the hydrocolon therapy. Pulmonary rehabilitation, we need to learn to breathe. So yoga, pranayam, spirometry, medical consultation, infrared, cryotherapy, deep tissue mobilization, and all this together in a small program is what we have looked at and put together. So let's look at these components. What is hyperbaric oxygen therapy? Hyperbaric, you can see this is like a CT scan machine. This machine, you go into it, and the principle is by improving oxygenation in our tissue. So even if you take, like in COVID, we did 100% oxygen, it doesn't really go into our bloodstream, right? What happens? Mechanism of action of hyperbaric oxygen is that increased diffusibility in the lungs and bloodstream by increased pressure of oxygen, so more oxygen goes into the tissue. How does this happen? Let's look at. So this you can see, the upper part is the normal pressure oxygen. So we are breathing 20% oxygen in 1 atmospheric pressure, right? This you can see the oxygen is going only into the red blood cells. So right now we are breathing, oxygen is going only into the red blood cells, but at increased pressure from 1 atmosphere to 1.5, 1.6, 1.82, when the pressure increases, more oxygen diffuses into the plasma. And now when it is in the plasma, then this flow, it is not limited to the red blood cell carriage. So this oxygen can go from the tip of the hair to the tip of the toe, like even where the red blood cells are not able to go. So diffusion or perfusion of oxygen in our body, and we all know that oxygen is the healing molecule. So we are increasing the oxygenation in our body by increasing the pressure of oxygen, pressure at which the oxygen is delivered. So this is through pressurized chamber. What you saw here is a monoplace chamber. We use it lots for children with autism and cerebral palsy and muscular dystrophies, along with our cellular therapy as a combination, and we find that the cells that we are injecting, the stem cells also get stimulated, the inherent stem cells in our body also get stimulated, and also there is an increased immunity in our body, and the whole biochemistry also improves. So this, you can see the child is inside with in adults, only the adults can go inside, and slowly maybe I can show you a video if it's there. So what does hyperbaric oxygen do? Strengthens immunity, stimulates oxygenation, improves metabolism, increases energy levels, reduces fatigue, improves overall functioning. In gynecology, what are the uses? Obstetrics and gynecology, there have been papers which have showed, though we don't preferably use hyperbaric oxygen during pregnancy, but I would say better for pre-pregnancy, like before in vitro fertilization or before IUI, HBOT can enhance the fertility by increasing the thickness of the uterine lining, because cell multiplication is stimulated. It prevents maternal-fetal injury, anemia, and helps depression in postpartum. It helps recovery of wounds in general, and those who have undergone C-section and unable to heal, also the healing can improve. But yes, there are a few side effects. There are some risks that we have to be careful about the pressure at which the hyperbaric oxygen is delivered. Generally, in our population that we are treating, we see sometimes ear infection or ear rupture, so the pressure is very important. Those who have seizures we cannot use. So maybe, pregnancy-induced hypertension, you have to be very, very careful. Pregnant women who are not suffering from carbon monoxide poisoning. So only in certain cases in pregnant, so we'll keep the pregnant females aside, but gynecological complication, aging issues, they can be taken care of with hyperbaric oxygen. It is non-invasive. For infertility, there are publications which you can go and have a look at, where hyperbaric oxygen has been used as a possible therapy for infertility treatment. So there are different papers which do tell about this. Several other celebrities have used, lot of celebrities use even, I think Anil Kapoor has somewhere put in Instagram that he uses hyperbaric oxygen regularly. Ozone therapy, oxygen is O2, ozone is 3 atoms of O, but you can see that the second bond is just very, very weak, so it is an unstable molecule and it's an activated oxygen. Dr. Pallavi will speak a little bit more about that. It's a very, very strong germicidal. It is medical ozone, reduces inflammation, reduces clots, has antioxidant capacity. It has 100% medical grade oxygen along with ozone. That's a combination which is used as a gas, and which I have told you about. So this is different ways. It can be used as a sauna, it can be used as boto, like breathing through oil, and it works by activating the antioxidant system and reduces inflammation. All the healing works that way, right? So ozone as well as HBOT in different ways contribute to the same. Also improves the gut health. When we give rectal ozone, it improves the gut health. It also stimulates the vagina, and in girls who are virgins and are not married in them, instead of vaginal ozone, only rectal ozone can be given. Boto is one way, ozone sauna is another. Intravenous administration using ozonized saline has been used in COVID. Then insufflations, we can do local insufflation even for hair, for knee, arthritis, for wound healing. So there are so many different ways that ozone can be used, and it has multiple effects. It thins out the blood clots. So it has been used in COVID as well. Only so those who have bleeding tendencies or in menstruation, ozone cannot be used. So what does it do? It reduces oxygen species, reactive oxygen species, reduces the inflammatory cytokines, it improves glutathione, superoxide dismutase, and has an antibacterial activity. Overall, lot of effects it has. So in gynecology, in infertility, in acute and chronic inflammatory diseases, in genital infections, bacterial vaginosis, chronic viral infections, dystrophic vulvas, postoperative complications, adhesions in women with tubal peritoneal infertility, genital candidiasis, bacterial vaginosis, and purulent inflammatory conditions, low oxygen reserve, poor egg quality, poor response. So it will be an adjuvant therapy. It will never be a standalone therapy. It will always be a adjuvant therapy. But side effects, we should not use it in gestational hypertension, or if sometimes very high dosage may cause damage to the mucosa. It can be used to improve female reproductive health. As I said, it stimulates, it can be used in tubal occlusion, endometritis, vaginitis, protects ovary from ischemia and oocyte loss. It can be used in placental blood flow in hypertensive pregnant women. So ozone therapy helps improve the blood flow in these patients. There are publications. Colon hydrotherapy, this I must tell you about. This, I love this particular therapy. Colon, you must do it once a year at least. It clears the complete intestine, really, and it resets your metabolism. Very, very simple. All the toxins, which are all the muck in your gut, gets cleansed, and then you restart your diet. So before starting any diet, please do colon hydrotherapy. The principle is that you are what you eat, so diseases start in the gut. So if you cleanse the gut, your immunity is better, your absorption is better, your constipation issues reduce, so many effects. So clean gut means better nutrition and stronger immunity. Infrared is another way of improving. So the UV is very superficial, but infrared goes deeper in and detoxifies. So without producing too much heat, infrared helps. It's like a sauna, and it has deeper penetration, and it can uses red lower level wavelength of light and deeper penetration. So it improves sleep, penetrates, promotes sweating and detox. It enhances immune function, muscle relaxation and pain relief, and circulation oxygen. Acupressure, all of us love massages, isn't it? So specific principle, when you put pressure on specific points, it induces relaxation, improves again oxygenation, reduces muscle tension, soothes your body. So all of these together, whole body cryotherapy. Those who are cold resistant can use it. Those who are very susceptible cannot. I could not tolerate this, but those who can, it really helps to reduce your joint and muscle pain. Lot of athletes, lot of sportsmen use this very, very regularly. So super cooled air at minus 180 degrees centigrade for 3 minutes. So it's a flash chills the body in a controlled cryo chamber. Neuromuscular pain, myalgia, headaches, migraine, mood disorder, inflammatory skin conditions. So many footballers, and Will Smith uses it, and Undertaker uses it after every of the days. So vitamin therapy, intravenous, I think some of you would already be doing it. Yes, I know. Nutritional deficiencies, you have to micromanage the nutritional deficiencies. I don't need to tell you this, very important. So we also add on cosmetology. I'm not going to talk about cosmetology here, but this is something, it's a part of our program. And we have a daycare program, a weekend program. So we do a 1 week thing, a 1 day thing, 2 day thing, based on what you can. So in conclusion, immune boosting as well as anti-aging can be done with this process of non-invasive procedures. Cellular therapy, already Dr. Rajput has told, and I'm just going to summarize this, that it has potential in gynecology, and that in different conditions it can be used, hematopoietic, mesenchymal, adipose-derived, and PRP. And there are publications for it. Of course, in tumors there are publications, both autologous cells, and in infertility, platelet-rich plasma as well as BMAC has been shown to have good. There are publications. PRP also, that has been, a lot has been spoken on it. Just to show you that there are studies, so it's good to go and read up the studies. Yeah, that for dyspareunia it has been used for, yes, and also for ovarian rejuvenation. Yeah, as Dr. Shada Jain is not very currently convinced with it, but there are publications, ma'am. So I think it is worth looking at. See here, use of autologous in vitro activation of ovaries by stem cells and growth factors on endocrine and reproductive function. So this is an article from Croatia. And lots in, I would say, Russian and Scandinavian countries, lot of work is happening rather than in the US, I think, in gynecology. Nah, okay, you know better, ma'am. Stem cells, it has been, yeah, so I hope, yeah, soon. So this is, so I am winding up. So Neurogen is, of course, we are more focused on neurological conditions and about 107 publication on various disorders. Please do go and have a look at it on autism, cerebral palsy, and physical disability. This is more the autologous mononuclear cells, and of course, COVID. So that's us, sorry. So that's us. You can reach us here and all our information is there. Thank you so much. I would like to hand over the mic to my colleague, Dr. Pallavi, who would be speaking on a little bit more detail on ozone therapy and explaining to you how this is done. I personally am a big fan of ozone. I have taken it myself in COVID, and I can tell you standing here, I have never been tested COVID positive. So even though we worked we converted into a COVID hospital. So, you know, I think I give all the credit to ozone therapy for it.